Hello, my name is Kevin Clement. I'm going to be talking to you about third-degree burns in my Ignite project. According to the CDC, someone dies in a fire every 2 hours. It's pretty significant. Types of burns. Dry heat injuries would be like your hand passing through a flame of a candle. Moist heat injuries would be like boiling water from the stove. Electrical burns would be like lightning, or industrial burns from welding. Radiation would be sunburns or cancer treatments. Let's review the layers of the skin. So you have the epidermis, dermis, and hypodermis. The human body can withstand temperatures of 111 degrees Fahrenheit. Prolonged exposure to this, above this temperature, can result in serious tissue damage. So as you can see at the picture to the left, first-degree burn would be like a mild sunburn. At the bottom, you can see a third-degree burn is full thickness all the way through all the layers of the skin. This will appear blackened, leathery, painless, and will cause disfigurement. So who's at risk for burn injuries? Well, children younger of 5 years in age and people older than 65 years of age. This is because they lack the necessary reflexes to pull away from objects that may burn them. So what do we need to look out for? On the assessment, you need to look out for white or charred skin. It may feel leathery or waxy. There's going to be no pain felt due to permanent nerve damage, edema, inhalation injuries, and look out for hypovolemic shock. Of the labs listed here, it is in my opinion that the CBC with differential, WBCs, CMP, lactic acid, and blood cultures are most important. These patients are highly at risk for infection due to their skin breakdown and injuries. In addition, you will want to watch out for their BUN, creatinine, GFR. It is due to the fact that we're going to be giving these patients lots of fluids. You want to maintain good renal function while we are rehydrating these patients. Bronchoscopy is also necessary for these patients. You want to look out for respiratory injuries in the upper airway. During the bronchoscopy, you can see any charred skin that may be in the upper airway. Patients that are considered high risk with major burn criteria are full thickness burns over 10% of the body surface area, patients greater than 60 years old in age. These patients should be transferred to a burn unit immediately, as pictured as Jackson. Patients will appear hypotensive and tachycardic. To determine the amount of body surface area, use the rule of nines as depicted on the right. If using the Palmer method, make sure you remember that it is the patient's palm that is 1%, not your palm. Phases of burn care. It is important to remember that caring for a patient that has suffered major burns will take time. This patient will have permanent disfigurement and a lot of pain. It is important to provide support groups. Your primary intervention is to stop the burning process. Remove jewelry and clothing carefully as to not remove skin with it. Pain management is paramount. Use aseptic technique to clean wounds and use non-adherent dressings. For fluid replacement, remember you will be using the Parkland formula, 4 milliliters times total body surface area percentage times body weight in kilograms. 50% of this fluid is to be given in the first 8 hours, with the remaining given in the next 16 hours. Wound care. Allografts are usually from cadavers. Xenografts come from pigs. And artificial skin can be bioengineered from collagen. There have been studies that show that there are proteins in sharks that can graft skin. Analgesics are necessary as these patients will be in a lot of pain. Antipyretics I found interesting were anti-itching agents. Bacitracin, gentamicin are topical antibiotic ointments, and silver has been proven to heal burns. Infection prevention is going to be a lot like your neutropenic and cancer precautions. You need to limit the visitors. No live plants or live flowers, no fresh fruits or vegetables. Patient-specific equipment is important, and hand washing is paramount. Complications. We all know about hypovolemic shock and the increased risk of infection, but I found decreased mobility interesting, as where the burn injury is close to a joint will affect mobility. Also, PTSD can form. Support groups are necessary for this patient and their family. Remember, disfigurement will be permanent for this patient. it is paramount that they find support groups to help them with this trauma. This concludes my presentation on third-degree burns. Thank you for watching, and these are my references.